Our next presenter is here. It's Leanne Daneyko, and she's one of our physiotherapists here at the Cross Cancer Institute. So she's going to be talking about, how you can manage some of your fatigue and try to get a little bit more energy in your day-to-day activities. So please welcome Leanne.
Thanks, Kara. Okay, I'm going to turn this because I want to hide behind the podium. Okay. So thanks for inviting me, and welcome, and I congratulate all of you for coming out and just seeking more information on what you can do to help yourselves. This talk here is we do an energized talk to sort of our patients during treatment and after that are welcome to come. And what I'm going to talk about today is how physical activity can maybe help you deal with some fatigue that you might still be dealing with after, even though treatments are done, and maybe you've left a lot of the follow-up here. When people see the words fatigue and exercise together, they don't often think that they're productive together, and that a lot of people are worried that I'm already really tired, or I'm still tired after having my treatments. I don't have the energy to exercise or be physically active. I put up lots of examples. Exercise or being physically active looks like a lot of things. It doesn't mean you have to race off to the gym and be pumping iron, but you certainly, those are options. But it looks like a lot of things. And we're talking about it here today because, as I said, many patients after treatments feel that their energy levels just haven't been restored, and some patients report it months to even years after that their cancer-related fatigue is, still lingering. I've just put up some of the reasons that we know. There's a lot of research about exercise, and I know later on this afternoon you're getting another talk by someone regarding exercise and survivorship, and I'm going to gear more towards fatigue and physical activity. But there are benefits to exercise in the general population, and a lot more research being done in the cancer population. And the research is basically saying, yes, you can reap these benefits as well, and that you have permission to be physically active, and that you actually should be physically active. So I won't, well, I'm hoping everybody can read most of those points. But some of you, again, you might not be feeling, geez, exercise, that seems like a word I don't want to be involved with. Why should you be exercising or maintaining a certain level of activity? We need to maintain a certain level of fitness in our lives just to live, just to do our daily things, to make appointments, to do our jobs, to take care of our homes and our families. So even if you don't want to be the marathon runner and the bodybuilder, you need to maintain a certain level of fitness just to get up in the morning, brush your teeth, take care of your home, and maybe get to your job, okay? So cancer-related fatigue is, like I say, most patients will report it at some point during or after their cancer treatments. And to some degree, some of it can be quite severe, and others it's really mild. It just, they weren't able to run their marathons. They can only run their 20K this week, okay? So it can vary, but I bring it up again because it can linger and still be with you even though your treatments are done. So if you think of your energy levels in your body like a bank account, and like most bank accounts, hopefully you are putting some money into the bank account before you go, you go into debt and spend it. So there are things we do in our lives that build up our energy bank, and there's things, and we also need to spend our energy wisely. So if you sort of succumb to the fatigue or to, our well-meaning family and friends, often with a cancer diagnosis, our family and friends take away a lot of our physical activity. They want to walk your dog, do your grocery shopping, clean your house. And pretty soon you've become a couch potato through no fault of your own, but through the goodwill of others. If you don't like exercising, I tell my patients, well, then you need to keep doing your housework and walking your dog and taking care of your family, because that is a way of maintaining that level of fitness. But there is a balance, okay? A lot of patients that experience fatigue can get really keen. They hear something, I'm supposed to exercise, I'm supposed to be active, and they go back out and they try to do too much, and then they crash. And their energy levels, now they're gone into debt. They've spent more out of their bank account than they had built up. And then they swear at us because they think, that lady said exercise was going to help me, and now I feel worse than I ever did. So it's finding that balance. What am I doing to build up my energy bank, and what am I doing, how am I spending it, how am I picking and choosing? So physical activity or moving is a way to build up your bank, okay? It's a way to condition yourself. The same way someone training for a marathon wouldn't wake up and start running 26 miles. They might start running a mile. They might start running for a minute, walking a minute, running, walking, and building on that, okay? If you are still experiencing fatigue and you can't imagine where you're going to start as far as physical activity. The point of this slide is to say that lots of little bouts add up. 3 10-minute walks in a day is equivalent to a 30-minute walk. You will get benefit from little bouts of exercise through the day, so you don't have to commit to an hour walk or at one time if that's an issue for you. I put this in, and this is one of our slides from our talk during treatment, so again, if you might all be past your treatments, I'm not quite sure. But there are precautions. There are times that you should be careful about exercising or things you should be watching out for, okay? If balance is an issue, we don't want you taking up an activity that puts you at risk of falling. You know, maybe ballroom dancing or, gymnastics isn't your forte. Being well hydrated, which I know Andrea has probably addressed. Fatigue, we experience more fatigue when we're dehydrated. And certainly during treatments, many of our patients, dehydration is an issue between some of the medications they're put on. So make sure that you are well hydrated, and if you're not, that might be why you're not feeling great with your activity. If you're feeling stiff, sore, or more fatigue because of what activity you've chosen, you have to figure out what's going on there. Are you doing too much too soon, or is there something new going on that needs to be addressed? If you have bone metastases, those patients, aren't encouraged or shouldn't be doing sort of heavy resisted work. Anything that's going to put a lot of tension through bone can be potentially dangerous, or anything that puts you at risk of a fall where you could sustain a fracture. So if you have bone metastases, you would want to talk to your doctor about the physical activities you might be thinking of participating in. If you were we tell people during treatment days or blood test days aren't days you should be having a heavy exertion day, but again, I'm not sure you guys might be all done that. And certainly if you have other health issues, if you are diabetic or have heart issues or arthritis in your hips, you have to pick an activity that is suitable for your other health issues, okay? In our big talk that we do with our patients, we encourage walking because it's a functional activity, and if you are able to walk, walking is a relatively safe activity. You can do it anywhere. We can walk on the spot if we can't get outside to walk. Through the winter, it's sometimes difficult. But walking is an activity that we encourage for most patients, if they're able to take up, to try to do something as simple as that. And having said that, if you can't walk, we've taught our patients, bed exercise, chair exercises, or modified activity, stationary bikes, whatever. There is something you can do. You look at what your limitations are, and there is something that can be done usually. There are certainly times you should not be exercising, and racing pulse, fever, chest pains, nausea, suddenly short of breath, like more than you usually are, weak or tired, dizzy, faint, blurred vision. If you're experiencing a new pain in the bone, neck, or back, okay, if you've never had these pains and you're getting something new, this is it could be a warning sign of something else. So you want to be careful with that and get it checked out. Recurring leg pain or cramps, or if you're confused or disoriented. This isn't a time going out or go swimming in the pool or ballroom dancing. You want to be addressing these issues medically first, okay? Basically, we give our patients permission, even if you're the fatigued patient. The research shows that those who stay physically active report lower levels of the fatigue. And like I say, I know it sounds counterintuitive sometimes, but the research shows lower levels of fatigue and an improved quality of life. I think physical activity, and maybe Lori later on talking, I know, is very empowering. It's something you can do for yourself. Some of the research, I'll just cite one example in the breast cancer population. A good study done, I think it was in 2005, compared women who walked 3 to 5 hours per week to those who walked less than 3 hours per week. And that tumor group showed improved survival rates and reduced risk of recurrence of their disease. And they were 50% less likely to die from their disease by walking 3 to 5 hours per week over those who didn't. So that may not translate to every tumor group, but in that particular study, and it was a well-done study with a large population, we know that there are benefits, maybe even for survivorship, to being physically active. So I hope you heard something that will entice you to, if you've been active, congratulate yourselves. It's good for you for many, many reasons. If you aren't doing anything, I hope you heard something that maybe will motivate you to get up and do something. Basically, find something you like to do. Find somebody you like to do it with. It's easier to go for a walk with a friend and socialize than to sort of, sometimes we're not the most motivated people to help ourselves alone. So find someone you like to do it with. And that's it for me for this talk. You're going to hear me in a second because our occupational therapist is not here today. So I'm going to do her little spiel on. So that's, I think we're entertaining. We're entertaining questions after? Or? Yeah. Okay. So normally our occupational therapy department, somebody would be coming up speaking to this, making the most of your time and energy. When we're tired, there's a tendency to give up activities that we otherwise enjoy. And the primary goal of occupational therapy is to enable people to participate in activities which give purpose and meaning in life. So if you're ever wondering what is the difference between a PT and an OT, the PT is the person that's going to try to strengthen you and get you up walking and moving and stronger. And then the OT is going to take that, whatever you have left, and put it to good use in your day-to-day living function, whether it's your job or taking care of your home or getting dressed or preparing meals. So this session's to share some ideas and adaptive strategies to help you keep going to do the activities you enjoy and need to do. The OTs have all the fun, okay? So our activities of daily living are things that we need to do to take care of ourselves, and these can be modified to your levels of energy and physical abilities as needed. And what we often see is that we are creatures of habit, and that if we always used to stand at the kitchen counter to peel our potatoes and get our veggies ready for a supper, we think that we always have to do it that way because that's the way we've always done it. But I know our OT, when she does this talk, she said, I broke my ankle one year and I was in a cast for 8 weeks and I couldn't stand and do that. So guess what? I had to modify it. I had to sit. I didn't mean I didn't eat vegetables for the rest of the month. You sat down. She took care of her cooking chores in a seated position. So if your levels of if your energy levels are a bit low, or you've got some pain issues or other issues going on that might just mean you can still do things, you just have to modify and break those habits and just think, even for a temporary measure, maybe I have to do things a little different so I can still get things done. Out in the hallway was a yellow booklet that has a lot of ideas and strategies how to modify those normal day-to-day things we do at home. So maybe if you are having difficulty with those things, you grab one of those books and you can look through there. And a lot of it is just very common sense. But again, sometimes we lose our common sense when we're not feeling our normal selves. Things like just a few examples that you might see in that book. If you're having difficulty standing, it's okay to adapt the activity and sit. You can iron sitting at the couch. You don't have to be standing up at the ironing board. Personally, that's the activity I might give away to my family and friends. Let me walk the dog still, and you can iron and wash my bathrooms, okay? Consider wearing loose-fitting clothes and slip-on shoes. Getting dressed can be very difficult for some patients. Reaching down and putting socks on is one of the harder things for someone to do if they're fatigued, or their mobility is, if they're a little weak, or their flexibility is poor. So make life easier on yourself and find clothes and shoes that are more slip-on and looser, and you're not sort of struggling into those tight jeans. Consider an easy-to-do hairstyle. Keep toiletries within an easy reach. You might want to have the toilet bowl cleaner in every bathroom and not have to cart around the thing to each of the bathrooms. Okay? But those are just some sort of examples of things that you can modify your day-to-day living. Adaptive equipment. We have a loan program here at the Cross, and again, not knowing where everybody's at, but if this ever becomes an issue that maybe you aren't as mobile as you were, or standing up in the shower is a lot more fatiguing than it used to be, doesn't mean you don't shower anymore. But there's stools and stuff that can go on loan, or we tell you how to get the equipment that might make life a little more easy. So this is about spending your energy wisely so that you can do the other activities to help build up your energy bank. Okay. I'm not a morning person. What about you? Okay. There are times in our day, and you probably know it yourselves, when you feel better, and there's times that your energy levels are lower. Okay. So this is just an example. This is our OT's energy graph. It's to help you recognize, think about in your own day when you have higher levels of energy and when you're kind of feeling low. She cited that 7 o'clock in the morning, she's not a morning person. She feels pretty low energy-wise, okay? Sort of as the morning goes on, she wakes up. She has, a breakfast that sort of elevates, peaks things up for her. She noticed a spike in energy around 9 p.m. After supper. She would go for a swim, and after her swim, she had a little more energy. So how she would use something like this is, I'm not a morning person. I don't want to, when I get up in the morning, I don't have the energy to make the decisions on what I'm going to wear, make a lunch. But why don't I do all that at 9 p.m. after my swim, make my lunch, lay out my clothes for the next day, plan my day, so when I get up, I don't have to think quite so much until my energy levels are up. So it might just be a suggestion to you to look at your day. When you have those higher levels of energy, if you know you are a morning person or 10 a.m. is a good time, maybe that's the time you go for a walk with a friend, or you get your grocery shopping done, or you join that class, whatever you're thinking of doing. But if you need that afternoon nap, you have permission to take that nap. But find out, it'll help you maybe recognize too, do I get energized after a meal, or do I need my nap after a meal? Do I get energized after my walk? Or do I, am I doing too much, and is that running me down after my walk? Maybe a walk is too long, or maybe there's a hill that I shouldn't be doing. Okay? So you can, make one up at home and just start to plot out, what does my day look like, and how can I schedule in my activities to make things work. So the graph will help you planning your day, learning when it would be wise to adapt your activity if you need it. So if something is fatiguing you, maybe you adapt it, and noting which activities impact your energy levels the most. So what energizes you and what depletes your energy. Okay? Sleep. The fatigue that you're feeling, there's many factors that might be contributing to fatigue. We know the medications and the radiation therapy you may have gone through are fatiguing things. But if we're not sleeping well, if you're in pain and maybe emotionally distressed, going through a cancer diagnosis is very stressful. So there's a lot of factors contributing to our fatigue. And so if you aren't sleeping well, it may be impacting, it's another thing that might be contributing to that fatigue. So there's a few tips that if you again haven't thought about how can I adjust my sleep habits maybe to my benefit. Avoiding caffeine 6 hours before bedtime. Keeping your bedroom quiet and dark. I know they say, many people have a television in their room, and I think there's some study about, the lights of computers and TVs aren't very restful. They aren't very relaxing on the mind. So it's not maybe the best thing to do right before bed. Try and do your worrying during the day. Many people go to bed and they lie there and their mind doesn't shut off for a few hours. And you're worried about your appointments tomorrow, or, somebody you got to call, or something that's going on. It's suggested, the OTs might suggest you have a journal or a notebook beside your bed, or before you go to bed, you take 20 minutes and you jot down, what do I need to do tomorrow? What do I need to worry about tomorrow? So that you kind of don't have to worry about it when you go to bed. You can go to sleep and that list will be there in the morning for you to address. Okay? So limit or avoid work or watching TV in bed. Make your bed in your bedroom a place of sleep. Okay? Keep a regular sleep schedule. If you're someone who does like to nap, you should try to minimize your naps to half an hour. If you're finding that you aren't sleeping well at night, an hour and a half nap in the day may be too much for you, and it might be interfering with your sleep at night. So a half-hour nap should be enough to rejuvenate you a little bit, but not overly give you too much rest that you're not tired at night. If pain is an issue and you're not comfortable in bed, there are different mattresses, toppers, and the occupational therapist here, might be able to help answer some questions like that. You want a good pillow, you want a good mattress, you want to be comfortable in bed. And then there's relaxation techniques that people can use for sleep. The library here, the Patient Information Center, has relaxation tapes, some booklets, and there's a lot of ways to help yourself wind down before bed, whether it's listening to nice music, listening to someone talk you down through a relaxation technique of muscle tensing and relaxing. So anyway, if sleep is an issue and you are feeling tired, it should be addressed. And maybe you talk to your doctor even if a sleeping pill is necessary, if that's maybe the only course of action, because sleep is so important to everyone and to our recovery. And my last slide here, Amy just says there's also, if fatigue is an issue, there's follow-up with your doctors. Like I say, some of the things that may be still contributing to your fatigue might be medical issues that need to be addressed, okay? If it's anemia or depression or your thyroid, your hypothyroid, those are medical things that should be addressed. We no longer have a fatigue management nurse here right now at the Cross, so you can't go to her to chat, okay? But know that we're part of the rehabilitation department. If there's something you want some advice on some exercise, how to start a program, you can call us. For physiotherapy, you do need a referral to come see us in our department. For occupational therapy, you just need to call them, and they'll set up a time or just chat with you over the phone. Okay? Anyway, so thank you.